Pharmacy assistants play a vital role in ensuring smooth pharmacy operations, providing customer service, and supporting pharmacists with medication dispensing and inventory tasks. Employers look for candidates who are detail-oriented, knowledgeable, and good communicators. To help you prepare effectively for your interview, here are the top 30 commonly asked pharmacy assistant questions along with well-crafted answers. These responses cover practical scenarios, technical knowledge, and interpersonal skills to help you stand out confidently. 1. Why do you want to work as a pharmacy assistant? I want to work as a pharmacy assistant because it allows me to combine my passion for healthcare with my strong organizational and customer service skills. I enjoy helping people and ensuring they receive the medications and guidance they need. The role is meaningful, and I find fulfillment in supporting both pharmacists and patients. It's a dynamic environment that requires attention to detail and empathy, qualities I bring with enthusiasm and commitment. 2. What are the main responsibilities of a pharmacy assistant? Pharmacy assistants handle customer service, prepare and label medications, manage inventory, restock shelves, and maintain cleanliness. They assist pharmacists by organizing prescriptions, entering patient data, and verifying information. They also handle cash registers and advise customers on over-the-counter medications under supervision. Strong communication, accuracy, and knowledge of pharmacy procedures are essential. Their role ensures smooth daily operations, regulatory compliance, and high customer satisfaction in both retail and hospital pharmacy settings. 3. How do you handle a customer who is angry or upset? I remain calm, empathetic, and professional when dealing with angry customers. I listen attentively to understand their concern, acknowledge their frustration, and apologize if appropriate. I avoid taking it personally and aim to resolve the issue promptly or involve a pharmacist if needed. My goal is to de-escalate the situation respectfully and ensure the customer feels heard and supported, which helps maintain a positive and trustworthy pharmacy environment. 4. What would you do if you noticed a prescription error? If I noticed a prescription error, I would immediately bring it to the pharmacist's attention before processing it further. Patient safety is the top priority, and it's crucial to follow protocols when identifying potential issues. I would never dispense medication without proper pharmacist verification. My role is to support accuracy, ensure compliance, and reduce the risk of medication errors. Maintaining diligence and open communication is key in these situations. 5. How do you prioritize tasks during busy periods? During busy periods, I prioritize tasks by focusing on those that impact patient safety and service the most. I handle urgent prescriptions, assist waiting customers, and ensure medication availability. I communicate with my team to distribute tasks efficiently and remain organized. If needed, I jot down a quick task list and update it as I go. Staying calm, adaptable, and focused helps me manage workload effectively without compromising quality. 6. What do you know about handling confidential information? Handling confidential information requires strict adherence to privacy laws like HIPAA or GDPR, depending on the region. I ensure that patient data is stored securely, only accessed when necessary, and shared only with authorized personnel. I avoid discussing patient details publicly and never leave records unattended. Trust and discretion are critical in healthcare, and I take confidentiality seriously to protect patient rights and uphold professional standards at all times. 7. Describe your experience with inventory management. I've assisted with inventory tasks such as receiving stock, checking expiry dates, organizing shelves, and placing reorders when supplies run low. I've also helped maintain accurate records of medication quantities and adjusted stock as needed. My attention to detail ensures the right medications are available and up to date. I'm familiar with using inventory management systems and understand the importance of proper storage to maintain drug efficacy and regulatory compliance. 8. How do you ensure accuracy when dispensing medications? I double-check patient information, prescription details, dosage, and instructions before labeling and packaging. I follow a checklist and consult the pharmacist if anything seems unclear. I avoid distractions and stay focused, especially during high-volume periods. Accuracy is critical in medication dispensing to avoid serious health risks, So I take this responsibility seriously and always adhere to pharmacy protocols and quality control measures. 9. Can you describe your customer service experience? I've worked in fast-paced retail environments where I assisted customers with product inquiries, handled transactions, and resolved complaints efficiently. I always prioritize active listening, patience, and a friendly demeanor. I ensure customers leave feeling valued and well-informed. In a pharmacy setting, I apply the same principles while maintaining sensitivity to their health needs and ensuring confidentiality. Clear, respectful communication is essential to building trust and delivering excellent service. 10. What would you do if you couldn't find a medication in stock? If a medication is out of stock, I would inform the pharmacist immediately and check the inventory system for alternate locations or arrival dates. I'd politely explain the situation to the customer, offering alternatives if appropriate or contacting nearby branches. If allowed, I would take their contact details to follow up. Keeping the customer informed and showing initiative helps ensure they feel supported and reduces their frustration. 11. How do you stay updated with pharmacy regulations and products? I regularly review updates from regulatory bodies and pharmacy associations to stay informed about legal and procedural changes. I also read pharmaceutical newsletters, attend workplace training sessions, and consult with pharmacists for clarification on new guidelines or medications. Staying updated ensures I maintain accuracy, provide reliable information, and comply with healthcare standards. Continuous learning is essential in this field, and I actively seek out resources to improve my knowledge and service quality. 12. How would you respond if a customer asks for medication without a prescription? If a customer requests prescription medication without a prescription, I would politely explain that I'm legally unable to dispense it without proper authorization. I'd offer to help them find a suitable over-the-counter alternative if appropriate and refer them to speak with the pharmacist. If needed, I would recommend they consult their doctor. I always prioritize safety, legality, and professionalism when dealing with medication-related requests to maintain compliance and protect patient health. 13. How do you handle repetitive tasks without losing focus? I stay focused during repetitive tasks by maintaining a structured routine, setting small goals, and reminding myself of the importance of each task to patient care. Listening to instrumental music, if allowed, can also help keep me engaged. I take brief mental breaks when appropriate and rotate between tasks when possible. Maintaining concentration and consistency is crucial in pharmacy work, and I ensure every step is performed with the same level of care. 14. How do you ensure cleanliness and hygiene in the pharmacy? I follow strict cleaning protocols, regularly disinfect high-touch surfaces, keep counters and work areas uncluttered, and ensure hand hygiene before handling medications. I use proper storage procedures for all drugs and dispose of expired or contaminated products appropriately. Cleanliness directly affects safety and customer trust, so I make it a daily priority. I also ensure PPE is worn when required and follow local infection control guidelines to maintain a hygienic environment. 15. Have you ever had to multitask in a busy environment? Yes, I frequently multitask during peak hours, such as managing customer inquiries, restocking shelves, answering phones, and assisting with prescription preparation. I prioritize tasks based on urgency and safety, communicate with colleagues for support, and use time management tools when necessary. Multitasking in a pharmacy requires staying calm, organized, and focused. I've learned to remain efficient while maintaining quality and care, even when working under pressure or during unexpected rushes. 16. What would you do if you received a delivery with incorrect medication? If I received an incorrect delivery, I would report it immediately to the pharmacist and supplier, document the discrepancy, and separate the wrong items to prevent accidental use. I check the invoice against the delivery and follow protocols for returning or correcting the order. Timely and accurate reporting ensures inventory integrity and patient safety. Mistakes in medication supply must be handled promptly and responsibly to prevent any disruption in service or potential harm. 17. How do you manage confidentiality when dealing with phone inquiries? When handling phone inquiries, I verify the caller's identity before disclosing any patient information. I speak discreetly, avoid mentioning sensitive details in public areas, and ensure the call complies with privacy laws. If I'm unsure about releasing information, I consult the pharmacist. Patient confidentiality is critical, and I take every precaution to maintain privacy and protect sensitive data, especially when communicating outside of direct, face-to-face interactions. 18. How do you handle working under a pharmacist's supervision? I understand the importance of working under a pharmacist's supervision and always respect their authority and expertise. I follow instructions carefully, seek clarification when needed, and collaborate to ensure efficient workflow. I see the pharmacist as a mentor and a safety checkpoint, especially when dealing with medications or patient questions. I'm comfortable taking initiative within my role, but always stay within the scope of my responsibilities and defer clinical decisions to the pharmacist. 19. What skills make you a good pharmacy assistant? I bring strong organizational skills, attention to detail, and excellent communication abilities. I'm also compassionate, patient-focused, and quick to learn pharmacy software systems. My multitasking skills and ability to remain calm under pressure help me perform well during busy hours. I work well in a team, follow instructions, and am committed to providing safe and respectful care. These skills, combined with my passion for helping others, make me well-suited for a pharmacy assistant role. 20. What pharmacy software systems are you familiar with? I've worked with systems like RX30, Pioneer RX, and Meditech depending on the setting. I'm comfortable managing electronic prescriptions, inputting patient information, processing insurance claims, and generating reports. If unfamiliar with a specific system, I can learn quickly and adapt. I understand the importance of data accuracy and follow best practices when using any software. Efficient use of pharmacy software is key to smooth operations, accurate record keeping, and excellent customer service. 21. How do you handle expired medications? I regularly check expiration dates and rotate stock using the first expired, first out method. Expired medications are removed from shelves promptly, labeled, and stored in a designated area for safe disposal per pharmacy protocol. I document all expired items and report them to the pharmacist. Proper disposal ensures patient safety, environmental responsibility, and regulatory compliance. I treat this task with care to ensure no outdated medications are dispensed or left accessible. 22. How would you respond to a language barrier with a customer? If a customer doesn't speak English well, I remain patient, speak clearly and slowly, and use simple terms. I offer written instructions when possible or use translation tools or multilingual staff if available. If needed, I consult the pharmacist to ensure safe communication. Respect and understanding are essential, and I do my best to meet the customer's needs without compromising safety or clarity. Cultural sensitivity and effective communication go hand in this role. 23. How do you handle insurance claims or rejections? I review insurance details carefully, confirm patient information, and verify medication coverage. If a claim is rejected, I double-check for input errors, reprocess if needed, or consult the pharmacist. I explain the situation clearly to the customer, offer alternatives, and suggest they contact their insurer if necessary. Handling insurance issues calmly and accurately is important, and I always strive to help the patient understand their options without delay or confusion. 24. Describe a time you went above and beyond for a customer. A customer once needed an urgent medication that was out of stock. I called nearby pharmacies to locate it, arranged a same-day transfer, and followed up to ensure they received it. I also provided information on managing the delay and comforted the customer, who was anxious. Going above and beyond means anticipating needs and showing empathy. It's not just about transactions. It's about making people feel cared for and supported. 25. How do you handle mistakes in the pharmacy? If I make or notice a mistake, I immediately report it to the pharmacist and correct it according to protocol. Transparency and accountability are essential for maintaining trust and ensuring patient safety. I view mistakes as learning opportunities and always aim to improve systems or habits to prevent recurrence. Pharmacy work demands high accuracy, and I take responsibility seriously. Acting quickly and openly is key to minimizing risk and maintaining professional integrity. 26. How do you manage stress in a high-pressure environment? I manage stress by staying organized, taking deep breaths, and focusing on one task at a time. I remind myself of my training and stay positive. When overwhelmed, I communicate with my team to share the workload and ensure no detail is missed. Outside of work, I maintain a healthy lifestyle with rest and regular exercise. Managing stress well allows me to stay productive, positive, and supportive of patients and coworkers alike. 27. What do you do if a customer refuses to wait for their prescription? If a customer is unwilling to wait, I calmly explain the processing time and the importance of accuracy. I offer alternatives like coming back later or notifying them when it's ready. If possible, I ask the pharmacist for prioritization or suggest a partial fill if appropriate. Managing expectations and providing reassurance helps defuse frustration. I aim to keep the interaction respectful and focused on the best outcome for the customer's health. 28. How do you ensure a good team dynamic in the pharmacy? I contribute to a positive team dynamic by communicating openly, being reliable, and helping colleagues during busy times. I respect others' roles, listen actively, and offer encouragement when needed. I also accept feedback graciously and am always willing to learn. Teamwork is essential in pharmacy settings, where collaboration affects both efficiency and safety. I believe that maintaining mutual respect and supporting each other directly contributes to better patient care. 29. What are the key qualities of a great pharmacy assistant? A great pharmacy assistant is detail-oriented, dependable, empathetic, and adaptable. They must have strong communication and organizational skills, along with the ability to multitask and remain calm under pressure. A willingness to learn and follow safety protocols is also essential. Great assistants support the pharmacist, serve customers respectfully, and maintain the pharmacy's workflow. It's a role that blends technical precision with human compassion, qualities I strive to demonstrate in every interaction. 30. Why should we hire you for this position? You should hire me because I'm passionate about patient care, well-organized, and experienced in customer service. I bring a positive attitude, strong attention to detail, and a commitment to maintaining high standards in every task. I'm quick to learn new systems, respectful of privacy, and always eager to support the pharmacy team. My reliability, communication skills, and drive to make a difference align perfectly with the values of a high-performing pharmacy environment. Preparing for a pharmacy assistant interview involves more than memorizing facts. It's about showing your dedication to patient care, accuracy, and teamwork. These 30 questions and answers are designed to help you anticipate what employers value most and express your strengths clearly. By practicing your responses and reflecting on your experiences, you'll build the confidence to make a great impression. Remember, professionalism, compassion, and attention to detail are your greatest assets in this role.